This week we've been talking about the acid-base balance within the human body. One of the main organ systems associated with acid-base balance is the respiratory system, the urinary system, and the excretory system. Today we'll talk about respiratory acidosis. In this PowerPoint, we'll discuss how it affects the respiratory system, what it actually is, how it happens, some symptoms of acidosis, more specifically respiratory acidosis, and treatments for respiratory acidosis. So please enjoy. The respiratory system allows for the intake of oxygen and the release of carbon dioxide. This is known as external respiration. The respiratory system consists of lungs, larynx, bronchi, trachea, and alveoli. The alveoli is where the gas exchange between oxygen and carbon dioxide occurs. Respiratory acidosis is a condition characterized by an increase in the levels of carbon dioxide in the blood, leading to an imbalance in the body's acid-base status. This can occur due to various reasons, such as impaired lung function, respiratory muscle weakness, or inadequate ventilation. When CO2 levels increase, it combines with water in the blood to form carbonic acid. Carbonic acid then dissociates into hydrogen ions and bicarbonate ions. The accumulation of hydrogen ions in the blood leads to a decrease in blood pH, which results in acidosis. Compensatory mechanisms may take some time to fully restore the acid-base balance, but the effectiveness of the compensation depends on underlying causes and individual factors. Some common symptoms of respiratory acidosis include shortness of breath, rapid breathing, confusion, fatigue, headache, and weakness. In severe cases, it can also cause drowsiness, seizures, and possibly a coma. If you suspect you may be having respiratory acidosis, it's best to consult a medical professional. When the body experiences respiratory acidosis, it tries to compensate by increasing the excretion of acid through the kidneys and retaining more bicarbonate ions. This helps to restore the pH balance in the blood. The compensation process can take some time, and the body may need medical intervention to correct any underlying causes. To compensate for respiratory acidosis, the body employs many mechanisms. The primary compensatory response is to increase renal bicarbonate reabsorption. The kidneys reabsorb more bicarbonate ions from the urine, which helps raise the blood bicarbonate levels and restore the pH towards normal ranges. Bicarbonate ions are reabsorbed by the renal tubules. These ions are exchanged for chlorine ions through bicarbonate chloride exchange. The exchange occurs mainly in the proximal tubules of the kidneys. The respiratory system can also make adjustments to compensate for respiratory acidosis. Over time, the body may increase respiratory rate and depth of breathing or hyperventilation to release excess carbon dioxide from the body. This helps decrease the carbon dioxide levels in the blood and restore the acid-base balance. Treatment for respiratory acidosis depends on the severity and underlying cause. It may involve improving lung function. Lung function can be improved through bronchodilators or oxygen therapy. In some cases, mechanical ventilation may be necessary to assist with breathing. Additionally, addressing the root cause, such as treating viral infections in the lungs or removing obstructions, is crucial for long-term management. These are the references I used to put this presentation together. I hope you enjoyed. Thank you for listening.